Namaste, it's me, Dr. Rekha. Today I'm here to discuss about validity and reliability of research instruments in quantitative research. Before moving towards our discussions, I would like to start with this quote by Carol Smith. Until we have established reliability, there is no sense at all in wasting time trying to make the things go faster. This presentation provides an overview of the concept of validity and reliability in research instruments, emphasizing its critical role in ensuring accurate measurement and the reliability of research findings. This presentation also explores various types of validity and reliability, especially focusing on content and phase validity and different types of reliability, the methods used to establish them, and the practical implications of using valid and reliable instruments. By the end of this session, you will be better equipped to critically evaluate the methodological rigor of the research tools and ensures the credibility of research outcomes. Validity and reliability are the most fundamental domains in the assessment of any measurement methodology for data collection in good research to ensure that instruments accurately measure what they are intended to measure, validity, and produce consistent result across times and conditions, reliability. The proper evaluation of the instruments' reliability and validity are important steps as it helps ensure that the research will have greater level of generalizability and can help limit and reduce confounding variables in the measurement tool. Thus, the validity and reliability of the instrument may enhance the credibility, accuracy, and applicability of research findings. Validity is one of the most important characteristics of measuring a construct. It refers to the degree of extent to which an instrument or test accurately measures what it is expected to measure. In simple terms, it answers the questions: are we truly measuring what we think we are measuring? When selecting an instrument, it is important to ensure that the right measure for the variable and that it contains adequate items to measure or to fully capture the construct. We need to ask questions to ourselves. For example, if we aim to measure the degree of dehydration using only the amount of fluid intake by the patient may not be the valid measures. Similarly, if we intend to assess the knowledge about self-care among patients with diabetes mellitus, all items in the instrument should directly relate to the knowledge about self-care. It is also important to recognize that validity is context dependent, meaning that an instrument's validity can vary between populations and settings. While establishing validity, we must be clear about what is to be measured, on whom's, and under what conditions. When reporting validity, it is essential to specify who the subject were and the circumstances under which validity was assessed. Validity can be determined through experts' opinion by comparing the instrument with a recognized standard, or particularly in the case of criterion validity, thorough objective methods. Other type of validity often rely on subjective judgment. It is important to note that instrument validity is not the same as the internal or external validity. Although it contributes significantly to internal validity of the study. Some important features of validity are that it applies to all form of assessment, including performance and behavioral measures. It is an ongoing process rather than a one-time evaluation. It is not only a measurement principle, but also a social value with important implications for judgment and decision making, and it is not a fixed property of a test as validation is an unending process. The four main types of validity are content validity, face validity, criterion validity, and construct validity. Now let's turn our attention to content validity. Content validity refers to the adequacy of the sampling of the domain being studied. It is an expert's opinions about the adequacy, appropriateness, and completeness of the content of the instrument based on their knowledge and experiences of subject matter. Content validity addresses the question, do the items in the instrument truly represent the content domain? When evaluating content validity, researchers consider how well the of the instruments relate to the content domain, or how well the elements of the instruments relate to the content domain, and how closely the test questions reflect the concept of interest. In this context, content validity is directly related to objectives and how well those objectives are fulfilled by the instruments. Content validity is directly related to the relevant components of the concept being measured. If key aspects are missing or irrelevant aspects are included, validity is compromised. Importantly, content validity is established through experts' opinion or judgment. These experts evaluate the instrument's content for its relevancy, adequacy, cultural appropriateness, completeness, accuracy, and language based on their experiences and prior research. This is very subjective process, but it is essential, especially for the instruments like questionnaire, interview schedule, checklist, and inventories, where comprehensive coverage of the topic is critical. According to Green and Lewis, establishing content validity can be approached through 5 key stages. The process begins with a literature review, where existing research and theoretical frameworks are explored to understand the concepts in depth. Next is the personal reflections, which relies on the researcher's judgment and expertise to assess the construct. And the third stage is the identification of the component of the concept, breaking it down into its essential parts. This is followed by the identification of specific items that will represent each component within instruments. Finally, the process concludes with empirical analysis of items, where these items are tested and refined based on evidence to ensure they truly measure what they are intended to measure. This is the content validity index form, and this is on widely accepted method for assessing content validity is the content validity index as outlined by the Pollitt and Beck 2021. The content validity index encompasses 3 distinct measures that allow for a more precise evaluation of content validity. When establishing the content validity of our general self-efficacy instruments as in figure, it is essential to develop a content validity form. This form systematically lists all items of the instrument as rows, with each item representing a unique aspect of general self-efficacy. In the column of the form, a rating scale is provided to enable experts to evaluate each item based on its relevance. Specifically, experts are to rate each item using a 4-point scale ranging from 1 not relevant to 4 very relevant. Moreover, experts are encouraged to provide qualitative feedback for each item. This feedback is invaluable as it offers guidance for necessary modification, ultimately enhancing instruments' overall quality. Once all experts' evaluations are collected, the ratings are analyzed to calculate indices such as content validity index. This quantitative measure helps determine the level of consensus among experts regarding the validity of each item, thereby ensuring the robustness of the instrument's content validity. The first measure is the item level content validity index, ICVI, which is calculated by dividing the number of experts who rate an items as 3 or 4 by the total number of experts. Items receiving ratings of 3 or 4 are considered relevant, whereas those rated 1 or 2 may be deemed irrelevant or require revision. The ICVI values range from 0 to 1 for panels consisting of more than 5 experts, and ICVI of 0.78 or higher deemed acceptable. More specifically, an ICVI of 0.79 or above indicates that the item is valid. A value between 0.70 and 0.79 suggests the item should be revised, while a value 0.70 implies that the item should be eliminated. The second measure is related to overall scale content validity index, SCVI, reflects the overall content validity of the instrument and can be calculated using two approaches. The first approach is scale level content validity index average that can be calculated by the average of ICVI scores across all items. And a value of 0.90 or higher is generally acceptable for scale level content validity index average. And the second one is the scale level content validity index universal agreement represents the proportion of items that all experts rate as 3 or 4. An ideal value for SCVI universal agreement is 1. As shown in this slide, we have calculated the ICVI and SCVI for the general self-efficacy instrument based on the opinions of 3 experts. Without deleting the items with an ICVI below 0.78, the SCVI average was 0.97. The lower ICVI for item 5 was due to disagreement from one expert. We can see here expert and all items had an ICVI greater than 1 except for item number 5. After removing the items with ICVI below 0.78, that is item number 5, the SCVI average increased to 1 and SCVI universal agreement is 1, also 1. You can see it here. In addition to content validity index, the content validity ratio is used to determine the essentiality of each item as proposed by Loshi. In this method, experts rate each item on a 4-point scale from 1 not necessary to 4 definitely essential. Ratings of 3 and 4 are interpreted as essential, while ratings of 1 and 2 are considered not essential. The CVR is calculated using the formula CVR equal to number of experts who indicate the item as essential, and N is the total number of panelists or experts. According to Loshi guidelines, a CVR of 0.99 is the minimum acceptable value when there are 7 experts. However, a CVR of 0.78 or above is often deemed acceptable in practice. According to Rutherford Hamming 2018, items falling below this threshold should be revised or removed. This is the content validity ratio related form where we can put the column as content essential with 4-point rating scales ranging from 1 not necessary to definitely essential as 4. And on column with rows, we can put the number of items reflecting the general self-efficacy scale. In conclusion, by systematically applying the CVI and CVR methods, researchers can make evidence-based decisions about which items to retain, revise, or discard. In this slide, we can see here we have taken the 7 experts' opinions regarding content validity. And based on their response, we can calculate this content validity ratio by using the formula mentioned in the slides. Now moving to the face validity, it involves an overall assessment of an instrument regarding its appropriateness to measure a particular attribute or phenomenon. It refers to the face value or outlook of an instrument by a panel of experts or respondents, and it mainly focuses on appearance and apparent attractiveness of an instrument, which may affect the instrument's acceptability by the respondents. And face validity can be rated by the person who takes the test, that is the prospective participants, the non-professional users who work with the results of the test, and the general public, and the judgment of instruments by a panel of experts. Similarly, as noted by the use of 2019, face validity can also assessed quantitatively by examining the clarity and comprehensibility of each item across all domains. Face validity also refers to the response process evidence of validity. And in this slide, you can see the face validity form, which uses a 4-point rating scale, 1 not clear and understandable, 2 somewhat clear and understandable, 3 clear and understandable, 4 very clear and understandable. Item rated as 1 or 2 are considered unclear or difficult to interpret, while those rated as 3 or 4 are deemed clear and comprehensible. Based on these ratings, we could calculate 2 indices, item level face validity index and scale level face validation index. As shown in this slide, we consulted 10 experts to assess the face validity of general self-efficacy scale and quantified their evaluations. The experts' responses were compiled into this single form and we calculated both item level face validity index and the skill level face validity index. The IFVI is obtained by dividing the number of raters who scores an item as 3 or 4 by the total number of raters. To assess the overall face validity index of the instruments, the SCVI average is calculated by averaging the IFVI scores across all items. These FBI scores range from 0 to 1. Higher values indicate greater clarity and comprehensibility. According to Dalawi et al. 2023, an IFVI of at least 0.83 and SFVI at least 0.90 are considered acceptable. Meeting these criteria ensures that instrument is clearly understood by its intended audience, thereby enhancing its practical usability and effectiveness. When we can see in this figure, when evaluating face validity, experts or participants judge whether an item appears on the surface to measure what it claims to measure. For instance, we consider general self-efficacy as an abstract construct. At the conceptual level, it is typically measured using general self-efficacy scale, which yields general self-efficacy at the empirical level. To assess the face validity of a general self-efficacy scale, experts or prospective participants review each item to determine whether it genuinely reflects some aspects of general self-efficacy, such as logical reasoning, verbal comprehension, or problem-solving ability. And we can seek experts' opinion by using 4-point scales, which was discussed earlier. Now, moving towards criterion validity. Criterion validity is always concerned with establishing a relationship between the scores of an instrument with the scores of some other sound criterion. And it is also known as a process of validating of new measures, either by describing it as a good criterion for the present time, that is concurrent validity, or by describing the predictive ability of that measure, that is predictive validity. For criterion validity, for criterion validation, we should compare the new measures with the old measures. If the new measures obtains the same results as of old measure, then the new measure is said to be valid. The following figure shows that there is a single concept at the conceptual level for which the new measures and the old measures are to be compared in their empirical level. Concurrent validity is demonstrated when a new instrument's scores correlates well with those of an established validated instruments, measuring the same construct at the same time. For example, if a newly developed self-compassion skills show concurrent validity if its results closely match those of the established self-compassion skill developed by NAEF 2023. In terms of predictive validity, it refers to the extent to which the new instrument can accurately predict future outcomes or behaviors related to the construct. If the new self-compassion skill can successfully predict future psychological outcomes such as reduced stress levels, increased well-being, or better coping skills measured at a later point in time, then the skills demonstrated the predictive validity. Now, Turning to the construct validity, which is concerned with examining how well the instrument is measuring the construct it claims to be measuring, establishing of construct validity of an instrument is more difficult than establishing other types of validity. There is no single best way to study construct validity. In most cases, it should be demonstrated from a number of perspectives. The more strategies are used to demonstrate the validity of the test, the more confidence in the construct validity of instruments. In this slide, we can see that at the conceptual level, we have two different concepts, and we are looking for the relationship between these concepts. And at empirical level, we have old measures with different concepts or might be similar concept, and there is a new measures, and we are looking for the relationship between old measures with different concepts with the new measures of our concept of interest. We can see in this slide there are different types of construct validity, and construct validity can be demonstrated by using differential groups, known groups, content analysis, correlation coefficient, factor analysis, or pretest post-test interventional studies. According to Liabiondo, Wood, and Haver 2022, types of construct validity can be assessed by hypothesis testing, multi-thread multi-method methods, and contrasted group methods, as well as factor analysis. Along with validity of the instruments, we need to have the reliable instruments. For assessing the reliability of instruments, we need to perform pretesting. And pretesting is the process of evaluating the questionnaire and survey procedures in advance to assess whether they are going to cause any problems for respondents and interviewers, and whether the survey is meeting its intended objectives. That's why, according to Campanelli 2008, the instrument developer plays a crucial role in evaluating how effectively a research instrument supports the four cognitive processes involved in answering a questions. Is our instrument is comprehensible, and is there any difficulty to recall or judgment or report the responses? We need to ask like this, and pretesting a survey instrument is a vital step in ensuring its validity and appropriateness, and it can be conducted through through both experts-driven and respondent-driven approaches. Expert-driven pretest involves consulting specialists in a relevant field to identify potential problems with survey items or responses options. For example, a child behavior expert may assist in detecting measurement issues within a newly developed behavioral checklist. This method is particularly useful for assessing face validity and construct validity. Experts may be asked to go through the full survey and rate each item using a Likert scale, which focuses their evaluation not on personal opinions but on how accurately each item represents the intended construct. In contrast, a respondent-driven pretest involves a small subset of the target population participants who share similar cultural and demographic characteristics with the broader group to be surveyed. This method helps ensure that the instrument is understandable, culturally appropriate, and contextually relevant from the respondents' perspectives. Together, these pretesting methods strengthen the instrument's validity and enhance its effectiveness in capturing reliable and meaningful data. During the pre-testing phase of survey development or adaptation, several qualitative methods can be used to evaluate the clarity, relevance, and functionality of the instruments. One most commonly used method is behavioral coding, in which researchers administer the survey in person and observes the respondent as they progress through it. Specific behaviors such as hesitation, confusion, skipped items, and corrections, example, erased or crossed out answers, are carefully noted as they may indicate problems with question, wording, or survey structure. Another valuable method is the cognitive interview, where respondents are encouraged to think aloud and verbalize their thought process while answering each question. This approach helps them identify potential misunderstandings, ambiguous wording, or interpretive issues from the respondents' perspectives. Following the completion of the survey, individual debriefing allows for on discussion between the researcher and the respondents to review specific questions, focusing on clarity, comprehensiveness, and whether the response options are mutually exclusive. Additionally, group debriefing involves gathering several respondents for a focus group discussion to explore collective experiences and perceptions of the survey instruments, allowing researchers to identify broader items, broader issues, and suggestions for improvement. These techniques are instrumental in refining the tool before it is used in the large-scale data collection. Likewise, conducting a pilot study is an essential step in preparing a full-scale research project, as it enables the research team to address various practical and methodological aspects of the study. Pilot study is also called feasibility study, trial run study, or small-scale version studies. Pilot study supports the development and testing of research instruments to ensure its clarity, relevance, and appropriateness for the target population. And it also helps the overall feasibility of the study or survey, guiding the design, refinement of the study or survey, guiding the design and refinement of the research protocol while determining whether the proposed procedures are realistic and workable in practice. It is done in preparation for the major studies and is completed to determine if the full study can be accomplished, and it is also considered as a practical when there is concern that full-scale study may not be possible due to concern about cost, procedures, and personnel and other issues. And the minimum sample size should be 30 respondents to test the reliability of an instrument. So while doing pilot study, we need to include at least 30 respondents if we are planning to calculate the reliability coefficient of an instrument. By using the data obtained from pilot studies and pre-testing, we can calculate the reliability coefficient, and it refers to the consistency of measurement, how consistent the test score or evaluation results are from one measure to another. The less the variation an instrument produces on repeated measurements of the characteristics, the higher is its reliability. If an instrument is reliable, repeated administration under the same condition will yield the same results. It is considered as the instrument is reliable. and reliability is often expressed as reliability coefficient R, which is a key indicator to an instrument's quality. And instruments with low reliability fails to consistently measure the intended construct, thereby limiting the ability to adequately test research hypotheses. There are different techniques of assessing reliability of an instruments. The first one is equivalence reliability. The second one is stability, and the third one is the internal consistency. And we will discuss each techniques in brief in later discussions. As we know that equivalence reliability refers to the consistency of results obtained either when two or more forms of a test, example form A and form B, are administered to the same group, or when different raters or observer assess the same phenomenon. In this approach, the obtained scores are analyzed using a reliability coefficient to determine the degree of agreement, with higher agreement indicating a greater equivalence. For example, a rating scale developed to assess the cleanliness of a bone marrow transplantation unit could be used by two observers who rate the unit simultaneously but independently, and their level of agreement would indicate inter-rater reliability. That's why inter-rater reliability refers to two different observers or raters observe a single phenomenon simultaneously and independently with the same instruments. Likewise, parallel test reliability involves administering one form of the test to a group, then administering an equivalent form shortly afterward to the same group. If the correlation between the two sets of scores is high, the instrument is said to have good parallel test reliability. Whenever feasible, developing two forms of an instrument is preferred for assessing reliability. In some cases, different instruments can be used to measure the same construct. For example, anxiety could be measured through physiological indicators such as pulse, blood pressure, and sweating, and the extent to which these measures agree provides an estimate of equivalence reliability. The kappa statistics is often used to measure the agreement beyond what would be expected by chance, ranging from +1 perfect agreement to 0. A key value of 0.80 or higher is generally acceptable, and good values between 0.80 and 0.68 are considered acceptable or substantial, and values below 0.68 allow only tentative conclusion. Now, moving to the stability or test-retest methods, it refers to the method of assessing reliability that examines whether an instrument can produce consistent results upon repeated administration. In this approach, the same test is administered twice to the same group of people with a specified time interval, typically about 1 week apart between administration, and the two sets of scores are correlated using a Pearson product moment correlation. The resulting correlation coefficient reflects the reliability of the instruments. To minimize the chance of memorization, the interval between The two tests should be at least 1 week. The correlation coefficient value of 0.85 or above is preferable, and values above 0.70 indicate an acceptable level of reliability. The stability test is most appropriate for such instrument designed to measure relatively stable characteristics such as personality traits, intelligence, self-esteem. However, it has limitations. If two tests are administered too closely together, a memory effect may occur. If the tests are spaced too far apart, changes in variables such as attitudes, mood, or knowledge may influence that results. The another form of reliability assessment methods is internal consistency, that is also known as homogeneity of the items of the instruments. An instrument is said to have internal consistency if all of its parts measures the same attributes. This type of reliability is appropriate only when the instrument is examining a construct, a highly abstract term that can be directly measured and must be inferred by certain concrete indicators. The commonly used methods to assess internal consistency reliability include Cronbach alpha or coefficient alpha, the Kudar-Richardson or KR coefficient, item total correlation, and split half reliability. Among these methods, Cronbach alpha is the most widely applied as it measures the average correlation among all items in a scale and is particularly suited for the instruments that use lighter type of questions. In contrast, KR20 or KR21 is specifically designed for that instruments with dichotomous items such as yes or no items or true or false responses. Meanwhile, item total correlation examines the relationship between each item and the total scores, thereby helping to identify items that may not be consistent with the rest of the scale. Similarly, split half reliability involves dividing the instruments into two halves, scoring each half separately, and then correlating those scores to assess consistency. To account for the difference in test length between the halves and the full scale, the Spearman-Brown prophecy formula is applied. Taken together, these methods provides strong evidence of how consistently an instrument measures the concept it is intended to measure. While calculating the reliability coefficient, we can use the SPSS software. In SPSS software, we have to go to the top menu, click Analyze. We can see here the top menu, Analyze, and we can click it here. Then we can receive in Analyze sections, we can find the scale. If we click the scale, and then we can see the reliability analysis, then we need to click the reliability analysis, and then when we click the reliability analysis, we can see source phase. SPSS data editors, we can see the reliability analysis with the number of items, and another box is related to items. That's why we need to send all the items that is related to test the reliability coefficient. We should transfer the variables into the item box. Then we need to go to the statistics button. Then we can see select item, scale, and scale if item related options in the descriptives for area and the correlation option in the item area. Then click on the continue. Then we can use leave the model option set as alpha, which instruct SPSS statistics to run Cronbach alpha or KR20. If we have the dichotomous response, SPSS calculate the KR20 coefficient, and we have the rating scales are like a type of items. SPSS calculate the Cronbach alpha. Then click on the OK button to generate the output. And we can see this table in our output file. If the inter-item correlation is less than 0.30, this suggests that the item may not be measuring the same underlying construct as the other items. In such cases, it is important to review the item wording to check for any ambiguity or confusion. You may need to remove or revise the item if it consistently shows low correlation with the rest of our instruments. Additionally, we need to check whether the item is reverse scored and ensure it has been scored correctly. Finally, conducting a factor analysis can help determine whether the item fits well within the intended factor or construct. We can also find the item total statistics in our SPSS output. According to Klein 1986, item total correlation above 0.20 are acceptable, whereas Costello and Osborne and other authors recommend a higher threshold of 0.30 for an item to be considered acceptable. And another informations we can find in SPSS output is the reliability statistics. We can find there is a Cronbach alpha and Cronbach alpha based on standardized items. Internal consistency reliability values between 0.7 and 0.8 as suggested by Cronbach alpha, Cronbach 1951 and Nunnally and Bernstein in 1994 as well as Just Right 2024 indicates an item's acceptables for the measurement instruments. In most cases, we should report regular Cronbach alpha unless our scale items are measured on different scales. Sometimes we might have the items with 5-point rating options and another items might have 7-point rating options and another document we might have the 3-point response options, so that we have to choose the items as standardized items. Now moving to the split half correlation. For analyzing the split half correlations, we need to select the split half in the reliability analysis command box. Then if we select the split half in reliability analysis command boxes, we can receive this output in our SPSS output file, and The Spearman-Brown coefficient is the most widely accepted measure for split half reliability. It adjusts the correlation between two test halves using Spearman-Brown prophecy formula to estimate the reliability of the full test. In SPSS, it is often labeled as Spearman-Brown coefficient. And the positive correlation greater than 0.75 deems the acceptable value of the proposed instruments. And this is the summary slide of our today's discussion. We can see here that we need to assess the appropriateness of the types of validity and reliability selected for a particular research. It is divided into consistency and accuracy. Consistency refers to the reliability. Reliability can be determined by stability, homogeneity, and the equivalence test. And for determining the stability, we can choose alternate or parallel forms of reliability as well as test-to-test reliability. And to determine the homogeneity of an instruments, items of the instruments, we need to calculate item to total correlation, split half, KR20 and Cronbach alpha. And for determining the relevance, we need to go through the parallel or alternate forms of reliability as well as internal reliability. In terms of validity, accuracy, accuracy refers to the validity, and validity can be ensured through content validity, criterion-related validity, and construct validity, along with face validity. And content validity can be established by calculating the content validity index and content validity ratio, as well as to determine the criterion related validity, we can choose concurrent or predictive types of criterion related validity. In terms of construct related validity, we can calculate the construct validity, establish construct validity through hypothesis testing, multi-trait, multi-methods approach, and contrasted group approach, as well as factor analysis. This is the concluding slides of today's presentations. And this is the take-home message for you all. If you are planning to use previously developed instruments in your research, it is important to consider the reliability and validity established during their initial development as well as in subsequent studies. This helps ensure that instrument is psychometrically sound and appropriate for the intended purpose. Furthermore, careful attention should be given to the population in which the instrument was originally developed and validated, as differences in culture, language, and context may influence how items are interpreted. Therefore, it may be necessary to assess the instrument's reliability and validity within the new study population to confirm its suitability and accuracy in the current research context. If you have any questions, I would like to request to email me at rekhatimalsina@pas.edu.np. Thank you so much. Have a nice day.